A measles outbreak in South Carolina is raising concerns across the Southeast, including here in Atlanta. There is a new article out this week on healthbeat.org. You're looking at it now, detailing how the South Carolina measles outbreak grew from 5 to 789 cases. Joining us now is the journalist behind that article, Allison Young, the senior national reporter with HealthBeat, to explain why this is worth watching for us here in Georgia. Allison, good morning. Thank you for your time.
Good morning. Thank you for having me.
You're welcome. So what's happening with the measles outbreak now in South Carolina?
So, South Carolina has been a hotspot for measles starting in October. And this is an outbreak that grew very slowly through the fall. And then, after the winter holidays, absolutely exploded in January. And one of the things that we're documenting at healthbeat.org is exactly how that happened.
And what are you finding? What is the how behind this spread?
There are a couple of factors that are leading to this. Number one is in South Carolina, as has been the case in communities across the United States, there has been declining numbers of people who are fully vaccinated against the measles virus. This is a virus that is highly contagious, but the vaccine is extremely effective. But there have been pockets of communities where the vaccination rates have fallen below 95%. That's a key number that the CDC and other experts say is needed to prevent the sustained spread of this virus in local communities. And so one of the things experts look at is the vaccine rates in individual schools. And in the areas around Spartanburg County, which is in the northwest part of the state of South Carolina, there are many schools that are below 90%, and some as low as in just 20 to 25% coverage of their students with the measles vaccine.
And why is that? I mean, we're a few years removed from COVID-19. Is there evidence that we're just experiencing virus fatigue, vaccine fatigue? I mean, is there any reporting to suggest that, or is there something more at play here?
There has been, I think it's important to remember that the majority of parents still are fully vaccinating their children. But there has been concern because of misinformation, disinformation, that somehow that there may be safety issues or ethical issues with the use of certain vaccines. But this is one of those tried and true vaccines that experts say we have used for decades with great success, that has a very good safety profile. But there have been, communities and pockets of people who have chosen not to vaccinate.
How should we be thinking about this spread here in Atlanta? You know, such a mobile area. Everybody travels through Atlanta, whether it's the airport or you're passing through here. And this is a neighboring state, by the way. So how should we be thinking about this virus here in Metro Atlanta?
Now is the time for people in Atlanta to be planning for the potential for this outbreak to come to Atlanta and to spread in Atlanta. It's notable. I worked in Atlanta for a number of years. Interstate 85 runs directly from Spartanburg County into the heart of Atlanta. And we are already seeing cases that are spreading from the South Carolina outbreak to other states. There have been documented cases in states such as Washington State and North Carolina. And as you mentioned, we are a very mobile society. So you can expect that this virus will continue to spread.
You mentioned you lived and worked, reported here in Atlanta, in South Carolina now. I'm just curious to know, anecdotally, how have you noticed people talking about the measles now versus maybe even a month or two ago in your state?
It's very interesting. I've spent quite a bit of time up in Spartanburg County recently. And one of the things that's a bit surprising is that there is not as much discussion of measles as one would expect. There is a bit of some of the organizations that have had outbreaks tied to them. There have been a number of schools, a number of churches where there have been significant exposure events. those organizations, for the most part, are not talking about this publicly. And one of the things that the Department of Public Health has been trying to do is really raise the profile that now is the time for people to seek out vaccination. But it's been a challenge in the community. They have sent mobile vaccination clinics to the neighborhoods where the outbreak is occurring, but have had relatively few people take advantage of that. There have been other more successful vaccine drives that have just been going on in the community as a whole, but it's a real challenge. And today, at around 1 o'clock, the state of South Carolina will release its latest numbers. And unfortunately, if things continue as they have, we're going to see another big jump in cases today.
And if we see that big jump, how close is the U.S. to losing its official elimination status? I mean, could we be days away at this point?
That is a really important question. So the United States has been declared to be measles free since 2000. But we had a very large outbreak in the state of Texas, which was one of the largest in decades, and now South Carolina has surpassed it, that began in late January last year. And whether or not we lose our status as being as having measles eliminated here is going to depend on a lot of really interesting scientific work that's being done by the CDC and others to trace the genetics of the virus. It needs to be sustained spread of the virus, and it's still not clear whether what's going on in South Carolina and in some of the other states, such as Arizona and New Mexico, is directly tied to the transmissions that began in Texas. So that's a scientific question that's still unclear.
Okay. Allison, thank you for your time. While we have you, will you just tell us a little bit about HealthBeat? It was my first time on your website last night, and I got to say, you guys are doing some impressive journalism. You got a free newsletter. What kind of stories can folks come to you for?
Thank you so much. Yes, we are a new news organization, and we are unique in that we focus on public health issues. Our news is free, and it's available for other news organizations to share. And so we focus on all of the kinds of issues that affect everyone's daily lives. And we would love for you to check us out. We're at healthbeat.org.
Well, we are happy to amplify your work here at 11 Alive, and we hope you come back on the show sometime, Allison.
Thank you. I'd love that. Thank you for having me.
Very good. Have a good weekend. And we'll be watching for those numbers coming up at 1 o'clock today. Should be very interesting to see what comes out of South Carolina, whether that outbreak gets more contained or continues to spread.